Hi, my name is Nancy Talam, and I'm going to present to you my business plan. Executive summary. This presentation aims to show a business plan for an opportunity identified in the nursing realm. The main question of concern that provides a blueprint for this business plan is that can nurse prevent nosocomial infection in a clinical setting by utilizing an alcohol-based waterless and rubbing solution instead of soap and water for hand hygiene? The main business opportunity in this case depends on the hygiene that have to be maintained in various community institutions in Colorado. Many patients and family have been impacted annually by healthcare acquired infection such as COVID-19. Executive summary. The results of the infections are evidenced in the death reaching more than 72,000 patients and costing healthcare organizations billions of dollars each year. Goals and best practices will be determined through evidence-based research. The presentation will cover the following areas of business plan: the current situation, the proposed program, presentation of options, market analysis, implementation, evaluation plans, and the financial analysis. The current situation. Up to 687,000 individuals in United States are affected by nosocomial infection each year, resulting to 72,000 deaths. Numerous individuals contract hospital-acquired illness yearly, which negatively impact healthcare system and negatively impact our financial and reputation. Reading Hospital, a part of Tower Health, has performed well compared to national infection targets, yet the effects on patients and employees and their families are very distressful. The current situation. Studies have shown that the affected areas include central line associated bloodstream infection in intensive care units and other facilities, catheter associated urinary tract infection in intensive care units and selected wards, surgical sites infection from, for example, from colon surgery, surgical site infection from abdominal hysterectomy, MRSA. As a result, can nurses prevent this infection in a clinical setting by utilizing an alcohol-based waterless hand rubbing solution instead of soap and water for hand hygiene? This provides the basis for the product that has to be provided to the market. Proposed program. This proposal describes a project with much promise and advances Tower Health long-term objective. More than 72,000 patients have died due to many infections such as COVID, costing the healthcare billion of annual money. Therefore, ensuring that trend is neutralized is essential to minimize the number of deaths due to compromised hygiene levels. This project will use an interdisciplinary team approach to train staff, implement a new protocol, and ultimately improve patients' outcome, lowering the cost of nosocomial infections and increase the patient satisfaction. A team with clear roles, responsibilities, and objectives will be formed for 6 months. Proposed program. Goals and best practices will be determined through evidence-based research to gather information on existing and hygiene methods. Observers will be taught After analyzing data, personnel will be re-educated and evaluated as necessary. The final data collection will be gathered into report at the end of the 6 months, reviewed, and then presented to change practice and inform all parties involved about the change. Increased compliance, improved patient outcome, and lowering of the cost are some of the anticipated outcomes. Proposed program. Using proper hand hygiene procedure is the main way of preventing these nosocomial infections. A team of nursing staff, infection prevention, epidemiology, clinical nurse specialists, medical staff, senior management, nursing administration, pharmacy, and a patient safety coordinator will be responsible for reducing the infections. 1 in every 25 patients will have infection, which will impact the workforce. Identify the cause of healthcare workers and hygiene non-compliance is also critical. And most of these staff will receive training and education on the values of compliance with what we call Head, Heart, Hands, and Health, HHHH. The proposed solution would need to have a document from several departments approving it. There will need to be a letter of approval from the nursing director. Presentation of option. A potent approach for encouraging an hygiene compliance is patient empowerment. Most patients and their families believe that it is their responsibility to raise concern if staff fail to wash their hands. Also, posters, patient movies, buttons, and brochures are all effective methods of encouraging employees to practice good and hygiene while empowering patients to warn workers who aren't following the rules. Okay. And then implementation measures to promote hand hygiene depends on the adequate training, workers' compliance, and the availability of appropriate resources, including disinfectant and washing gels, functional sinks, and an enabling atmosphere. Presentation of options. The evidence that is currently available suggests that employing multimodal technique to promote hand hygiene compliance reduces infection transmission rates. When combined with antiseptic practices, hand washing detergents are the most effective than water in reducing hospital-acquired infection illnesses. In an intensive care unit, hand washing using antiseptic was also linked to lower infection rates. Along with the use of alcohol bottle and refill containers, educational posters illustrating the proper time, location, and technique for hand washing will be created and displayed in all areas where people will wash their hands. The effectiveness of implementation will be assessed using an observation tool and professional will also receive these alcohol-based bottles. Market analysis. A thorough market analysis is necessary to map and categorize the available products and services, quantify demand and product reference, identify gaps and needs, locate current and potential suppliers, and analyze competitive dynamics. There are numerous opportunities with this project. Reduced nosocomial infection resulting in higher insurance reimbursement, better patient outcome, high patient satisfaction ratings, and greater compliance with magnet and other standards for recertifications to enhance the supply situation and create a sustainable and local market for the community over the long term. Sectors players can engage in business and influence the market by having a deeper awareness of the product and market landscape. Market analysis. It is crucial, or it is very important, to evaluate the size of untapped potential market and the size of the market for products and services connected to iron hygiene. Market segmentation is necessary to take into account various iron hygiene services level and associated technologies. To determine the dominating forces and prospective trendsetters, companies and competitors should be evaluated to determine and evaluate market share, pricing strategies, and overarching business strategy. Market analysis. In this project, the identified market is divided into 4 main categories, not limited to hospitals, school, dispensaries, and hospital sector. Each target group expressed different preference for hand hygiene products. Hospital favored automatic hand washing station with automatic soap dispensers in metropolitan areas. Additionally, they chose liquid soap over bar soap. They are linked to primary water supply and have access to clean running water. While some hand washing stations are made locally, a shortage has forced hand washing stations to be imported, especially during the pandemic. Implementation and evaluation of the plan. The pilot project is expected to take around 6 months to complete. The team will be selected during this period, given the role description and required behaviors and opportunity to gather information on evidence-based practice and relevant research. Together, baseline compliance of information for hand hygiene compliance, observers will receive training and be dispatched to their various locations. Following the final collection, the data and modification will be shared via copy and contact hours, L-stream, and policy updates before being implemented across all the sites. This table shows the time frame for the implementation of the project. So team selection will take approximately 1 month. The training of the staff will take another month. Gathering compliance level using trained personnel will take approximately 2 months. Analysis of gathered information will take 1 month, while the evaluation of this project will take another month. So after that, the staff will be evaluated to see how they did and provide feedback. The alcohol-based and would also be used for baseline and post-intervention stages of 2 phases of direct observation before and after the trial to measure the 3H I told you earlier. The rate of difference between the 4 H's, compliance prior and following the intervention, will be calculated using the difference, and the rate of difference between the 4H I already told you about in compliance prior to and following the intervention will also be calculated. The direct budget for the site, as well as the budget for the staff development department, will be implemented by the above costs directly. Direct costs related to it may include the breakdown that I've given you thoroughly to $30,000. The previous research has shown that intervention to lower the risk for ventilator-associated pneumonia have an increment cost effectiveness ratio of 14,250 per life year gain, and the intervention to lower the risk of bloodstream infection associated with central line have increased to approximately 23,277 per life year gained. And those are my references.